until I have a problem, until I have an illness, or until I'm in an accident or something that requires me to seek medical coverage, or medical care. I'll just take the insurance when I'm sick, take the insurance when I fall ill or have an injury, and then pay the fine, get the care, and then when I've received my care and I'm well again, I'll drop it. Okay? Well, that means that for all those other people who are paying in and not receiving care, they're going to be paying in higher and higher premiums. They're going to be paying in higher costs because they have to cover all of those quote-unquote free riders. Okay? What we found in Tennessee and Massachusetts is that the penalties are not sufficient to keep people from free riding. Okay? They're not high enough. And of course, the higher you make those penalties, the more political blowback you're going to get into, the more political pushback. People are going to feel very, are you going to make someone who's unemployed, has kids, pay fines for not purchasing health care? Right? So how do we deal with that? One of the other ways is to extend coverage on a means-tested basis. Means-tested subsidies. We're going to expand, essentially, Medicaid, the Medicaid program, and try to bring in all people who are within 133% of the poverty line, and bring in more people that way by subsidizing. Okay, so you see what we're doing. We are increasing government expenditure to cover more people. We are mandating that people purchase coverage. Okay, and we are trying to give them an incentive to not avoid or to not free ride on those people who are. That's the intention, that's kind of the goal of the plan here. All right? All of these things are contributing, or will eventually, I believe, contribute to a big increase in the demand for insurance, and likewise, an increase in the demand for health care. We'll look at that in a moment, the implications of that. In a sense, there's an approach here of treating health care not as a scarce good or service, but as kind of like a free good or a public good, kind of like a public utility, except that if you can't pay your bill, you still get the service. You just shift the cost onto someone else, either a paying insured or the taxpayer. That's kind of the idea here, so that we can extend coverage. Okay? All well and good. The point is, that's not consistent with the idea of bringing down costs. Okay? It is, in fact, consistent with driving them up. We'll look at here. The means-tested aspect of this, and this is the area that is still very murky. Most people don't understand how this is going to be implemented. I don't even understand yet, because it hasn't been done, how this is going to be implemented. These exchanges, these state-level exchanges. States are going to be required to fund the provision of insurance, health insurance, through these exchanges. These exchanges will act in some sense like a kind of public utility or public clearinghouse, where people will go, if they do not have insurance through their employer, to obtain insurance on a means-tested basis. Okay? And how each state sets them up is yet unknown. Some states are really pushing back against this and saying we don't have the means, we can't afford to do this, we need more help from the federal government, we need more subsidy from the federal level. Other states are kind of looking at creative ways of trying to set these things up. Other states are pushing and saying you have to push this back in time a little farther. We can't do this by 2014. We've got to have till 2017, say. Okay, that's kind of this is all still very much up in the air and uncertain as to how this will be delivered. Some additional mandates, some that you may be, again, familiar with here. This is an important one. Prevents insurance companies from excluding coverage for pre-existing conditions. Insurance is theoretically a product that is designed to spread risk, okay? And in order to do that in a way that is efficient from the economic point of view, you have to price risk according to its likelihood. Risk is the probability of some event or some less than desirable outcome from a choice that is made. So health insurance, to have accurate health insurance pricing, you need to have your premiums based upon the amount of risk that the insured subjects to the pool of other insureds to. Okay? So if someone has health problems, if someone has some pre-existing condition, then they are going to subject the pool of insureds to higher levels of risk. What this policy attempts to do is kind of in a way run roughshod over or ignore that basic economic reality of pooling of risk and pricing of risk. Okay? It basically says everybody is going to have access to health care at the same premium, at the same market price, regardless of the risk to which they subject their fellow insured. Okay? Whoops. Back. So in other words here, the policy does make concessions for age and smoking. Those are the two criteria that the policy does allow. In other words, premiums can be different, likely higher, for people who are older or who smoke. Okay? But otherwise, apart from those two stipulations, any other kind of health condition, any other pre-existing condition, or any kind of condition that someone would contract, cannot be effectively, efficiently, notice that I'm not saying fairly or equally, but cannot be effectively or efficiently priced according to the risk that they subject the pool of insureds to. Okay? Everybody has to be treated exactly the same. All right? Now you might think, okay, that's fair, that's equal, all well and good. That has very interesting, and indeed I would argue inefficient, implications for the delivery of health insurance, because it leads to, again, this problem of free riding. People who subject the insured pool to higher risk are paying a much lower premium. And where is that additional amount going to come from? It has to come from the other insureds. It has to, in other words, those who are healthier are going to subsidize, by mandate of this policy, those people who are less healthy. Okay? Because it's all about collectivizing the insurance pool by mandating payment, mandating enrollment, and then mandating on behalf of the suppliers of the product coverage. Okay? That's the idea here. It leads to systematic mispricing of risk or moral hazard. Okay? And moral hazard is just the idea that, go back to the free riding problem. What's my incentive to be covered for a particular condition and pay the risk that I, in the form of a premium, that I subject the rest of the insureds to, if it's free anyways, and if I'm required to be covered. So let's just sign up for the minimum, let's pay the minimum, everybody's paying roughly the same unless you're older or smoke, and then let's get as much as we possibly can. The idea is to maximize the benefit. People will attempt to maximize the benefit of the coverage regardless of how much they pay. And well, this is one of the problems that we have already, is that people try to maximize the consumption of health care given the coverage that they have. This should suggest something to you, that we do not have currently a market-oriented healthcare delivery system. We have a system that is a kind of is a quasi-market, or is a kind of bastardized, forgive my term, but bastardized market in healthcare. It's one that is already heavily influenced by government policy. We are kind of doubling down on the same type of program, subsidizing, extending coverage, and then regulating and mandating that coverage. We're just kind of doing more of what we've always been doing to extend coverage, and then arguing, I think illogically, that by doing that, somehow doing the same thing that we've always done, is going to bring the cost down. It's going to lower the price of premiums, or it's going to lower the cost of health care. I suggest to you that that's not going to happen. Okay? There are some additional aspects here. Some of these, again, you may be familiar with. Ban on lifetime limits, phase out of annual limits on health insurance benefits. These are all regulations imposed on the insurance industry, on the healthcare insurance industry. Okay? And these